conventional, the occurrence, the symptoms happen suddenly. The symptoms as a result of direct exposure to what? To trauma of another person. Now listen, it's as a result of the environment, working condition. But this one is as a result of experiencing somebody passing through terrible experience. Is that tautologous? Okay. Somebody is passing through that kind of terrible experience, very painful experience, and you are the one taking care of the person. You are exposed to this particular condition. But then even post-traumatic stress disorders, you know this one in particular, which happen after the individual is the individual that experiences the situation that that's what presents with post-traumatic what? Symptoms. Okay? So it's the individual. But while compassion fatigue is the one that is taking care of the person experiencing the terrible condition that is now getting involved. Those of you in trauma healing section and psychiatric nurses, you should be familiar with this one. But, however, not all long-term compassion, if people actually have compassion for people who are suffering for a long time, it does not necessarily lead to what? Compassion fatigue. It can also lead to a condition that is known as compassion satisfaction. So there is something like compassion satisfaction. In psychiatry or psychology, we would look at that a very positive coping style for the individual if it leads to this stage. While this other one is a negative coping style or a failure of coping at all. So there is compassion what? You also come across compassion satisfaction. And I think it is necessary we differentiate that one. This is when the individual become very, have you nursed a patient successfully, terrible condition, and you got to the resolution of that particular issue? How would you feel? I was the one that nursed that patient. I had the other person giving that kind of declarations when he was giving lecture, the psychiatric, the mental health person. Because there were patients that they gave up hope on them, but he restored them. That one is compassion what? Satisfaction. He's happy. He celebrated. He celebrated. And we should know those differences. Now, I want to look at the development of compassion fatigue. Okay, it's okay. The compassion fatigue is based on the perception that the individual who suffer post-traumatic stress, listen carefully, traumatic events are most likely to do what? To affect individuals who have knowledge of the events. What event? They are suffering. Have you not other patient? If you have not that kind, we did that in our department in Jos during that first crisis around that so many people were killed. Even staff of University of Jos that were living around Angwaroko were sacked. And many of them saw brutal killing. They saw their parents, their children, being killed in their presence. We calmed them in ASU Secretariat in Jos. We have to draft clinical psychologists to address them and to treat them. And the number of post-traumatic stress disorders we saw there were enormous. They are so frightening. So post-traumatic stress, people taking care of such persons are prone to what? To develop compassion fatigue. In fact, this is why it is also referred to as traumatic stress reaction from secondary what? Source. The person taking care of the person suffering with traumatic situation develops what? Traumatic experience as a result of observing, internalizing the suffering of the person. So yours is secondary. Your own post-traumatic stress is what? Is secondary. So that was another name they gave it. Maybe secondary traumatic stress disorder. That was initially what Figley tried to do with before he accepted the position that it must be compassion what? Fatigue. So this kind, like the last statement under there, you see, it says, this kind of compassion is called what? The cost of what? Care. It's the cost of care. The cost of care you pay for taking care of another person. Why I think that it is necessary for us to pay attention to, even when we go back, we look at this situation, even as we practice, we need to know that this exists and there is nobody that is immune to it. There's no one that is immune to it. But we can prepare people to do what? To develop what? Resistance. And I think that's the important thing for us to note about this particular condition. I'm just trying to look at. I wanted the diagram of the development of compassion fatigue. But then, these key components of compassion formation, I think is very important for us as nurses. And I want us to take note of them. Okay? The first one, this is the process of compassion. I'm talking about compassion now. In fact, maybe I don't know whether I've mentioned it. Compassion is the archetype. The archetype of what? Of nursing. Archetype meaning that it is a component, a building block in the nursing what? In the nursing profession. That is necessary, a necessary building block. Compassion is a major. That is probably that what a nurse. Compassion. That's very, very important. Okay? And what is it? It starts first. Meaning that compassion has to develop. Compassion does not happen in a void. Compassion has to do with what? Situation. So it first starts with what? Recognizing what? The suffering or the event or the experience the person is suffering, is passing through. It first starts with that. And then secondly, understanding of the universality of suffering. That suffering is what? there is no particular person or persons that are actually meant to suffer. That suffer, anybody can experience what? Suffering. That is the second thing that you need to know. Then thirdly, feeling for the sufferer. Feeling for the suffering is what follows when we understand that other persons are falling. Do we feel for them? There is a difference between sympathy. Sympathy is feeling sorry for what has happened to a person. But the one that has to do with feeling of the sufferer is empathy. And empathy has to do with you identifying with the suffering of the person. In psychology, we call it you entering the world of the sufferer. And that is a very, very dangerous point for any clinician or caregiver. The ability to enter the world of the person suffering. If you do not enter the world of the person suffering, compassion cannot be brought to bear. It is necessary for us. That's why we say sometimes you nurses that you carry injection and shook people. Part of the nursing training should be that any time during training, they should also shook you with injection. So that you know how what. Have you not seen nurses? You want to give them injection, you run around the table. I'm a qualified nurses. So. You run around the table. But you tell the patient, don't Allah. He said, please, it's stable. They want to give injection. It's not as easy. I'm just trying to use that to know that you need to get into the experience of the person. And it is necessary. This is for us, the war, and you are becoming what? If you cannot come out teaching in School of Midwifery, Ola, in Jos, one of my students, I was teaching them relaxation therapy, the Jacobson relaxation therapy. And she said, sir, I have not slept, nor even have the feeling or the whatever, to sleep for the past 2 weeks. Say for past 2 weeks. I say why?